A new report by the Centers for Disease Control shows the maternal disparity rate has worsened for Black women, who are 3 times more likely to die from a pregnancy-related cause than white women. Some health officials say most of these deaths are preventable. Joining me now for more on this, Interim Medical Director for the March of Dimes, Dr. Amanda Williams. Dr. Williams, thank you for joining us. Black maternal mortality has a devastating effect. Maternal mortality across the board has a devastating impact. We know that it's racism that's at the heart of why a lot of this disparity exists. So what do health providers need to know to help close this gap?
Well, thank you for this opportunity, Janae. And indeed, Black and Indigenous women are dying at rates that are 3.5 times that of their white peers. And first, we need to know who is at risk. Just like any other life-threatening condition, we need to be able to target interventions at the populations that are most at risk. One of the things we're really focused on at March of Dimes is promotion of low-dose aspirin for the prevention of preeclampsia and preterm birth. Just a simple over-the-counter low-dose aspirin can decrease the rates of preeclampsia by 15%, preterm birth by 20%, and preeclampsia is a leading cause of maternal mortality, particularly for Black women.
And Dr. Williams, we know that some of the barriers that exist are also as simple as health insurance plans, providing equitable coverage and access for midwife and doula. And this can be especially daunting for a first-time mom who may not know the difference or the benefits of both. Can you break all of that down for us?
Sure. Midwives and doulas are both associated with decreased rates of maternal complications during pregnancy. Midwives are licensed professionals who are experts in physiologic birth, experts in low-risk birth. Yet many midwives are not allowed to practice to the top of their scope. There are many limitations. And so expansion of midwife services is one of the things that March of Dimes is promoting. Additionally, doulas can provide psychosocial and physical support for pregnant patients. They are not licensed professionals, but they play a very important role in bridging from community inpatient to medical systems and can really help people navigate this birth experience.
Dr. Williams, I've done a lot of reporting on maternal mortality, and I think that you really broke down the difference between midwives and doulas and the difference between them, but the benefits that both can offer. So tell us how expectant mothers can take control, especially for those Black and Indigenous mothers who may not feel like they're supported or listened to by their health team.
So on a one-on-one basis, I always tell patients, this is your experience. If you feel like you are not being listened to, you can ask for a second opinion. Also, always bring someone with you. This is a medical system that was not trained to listen to Black, brown, sometimes poor, Indigenous. These are not the groups where our society says these voices matter. So we want to make sure that we're overcoming those biases by asking questions, by having someone come with you and advocate, whether it's a doula, a partner, a mother, so that our medical providers know that you're serious about your health, and we're going to do our very best to make sure that you get the care you deserve.
Yes, we know how important advocating for yourself, how important it is, but how difficult it can be. Dr. Amanda Williams, Interim Director for March of Dimes, thank you so much for being with us this morning.